Hi, thanks for joining us again to continue our conversation about the Bag 2 Laerdal's disposable resuscitator. Today we want to talk about some of the accessories that are available for the Bag 2, especially some of the accessories that have become more and more important as we face the COVID-19 crisis. So we see here the adult Bag 2, and it's connected to an endotracheal tube here on our Laerdal airway management trainer. And of course, got to put a plug in for the Thomas Tube Holder Select, right? Great device, the best devices to keep your airway secure. And there is no more important time in history to keep your tube in place as during COVID-19. So this in itself is an accessory for COVID-19. But we really want to talk about some of the accessories that you can apply to the BVM and the purpose that they serve to our clinicians today. So let's talk about, the first thing is this little connector right here. This simple device is called the manometer connector. And it connects a manometer, which is a gauge that measures airway pressure, and it allows you to connect it in your airway circuit. And an airway circuit is just a series of devices that goes from the patient to the ventilation device, or from the ventilation device to the patient. So the manometer adapter port allows you to put that to whatever measuring device that they use. In most cases it's on the ventilator or within the anesthesia machine in an OR, but it can also be a manual device. It's a gauge similar to what you would see on a blood pressure cuff. A simple device just connects to this by a tube. Also we have here, in regards to pressure, is a PEEP valve. And again, our customers have been asking for this for some time, but it's even more important now. And a PEEP valve really is positive end expiratory pressure, right? So the PEEP valve allows the clinician to maintain a certain level of pre-selected pressure in the airway to improve gas exchange. And we see with our PEEP valve here, it consists of two parts. It simply press fits onto the Bag 2 patient valve assembly. It has a gauge or a valve here, and you just adjust the pressure accordingly. So you can select as much or as little pressure as you would like, and that allows you to set that. It comes in two pieces. It's sort of a diverter as well as the PEEP valve itself. And again, this fits onto the patient valve assembly of the Bag 2, and it can be rotated, right? So if we remember how a BVM works, right? If we remember how the main principles of how the anatomy of a BVM works, when we squeeze our patient or our ventilation bag, air travels in through the patient valve, through a one-way valve, down into the patient's airway. When the patient exhales, gases come back up and travel up through, back into the same patient valve assembly, but is met by that one-way valve and then deferred underneath and dispersed through a flapper valve in the bottom, so the air comes out here. So by occluding that, or by controlling the release of that air, we can apply PEEP, or positive end expiratory pressure. Right? It's that simple. So two great accessories currently available for our BVM, the manometer connector and the PEEP valve assembly. Both available for the Bag 2 resuscitator. Trivia point, they fit onto the reusable silicone resuscitator as well. So I hope you found these tips helpful, and stay safe. Thanks for joining us.